Today, we'll look at non-alcohol substance abuse. As usual, we'll start with a quiz. A client with cocaine addiction would most likely be placed on which medication? Okay, you want to use your decision tree on this question. So I know my correct answer would be amantadine or Symetril, which is a drug used for addiction to cocaine. It's actually classified as an anti-Parkinsonian drug, and it gives clients with this addiction a substitute for the neurotransmitter dopamine. So my correct answer is A. I know B is wrong. B is used for opioid addiction. C is actually marijuana. It's not used for replacement therapy. THC stands for tetrahydrocannabinol. It's a principal psychoactive constituent of cannabis. And I know that D is actually wrong. It's used for alcohol abuse. So let's look at some medications or drugs that fall under this category of non-alcohol substance abuse. The first would be your barbiturates, such as your downers, barbs, pink ladies, rainbows, yellow jackets. We know that a barbiturate is a drug that acts as a central nervous system depressant. They are effective as anxiolytics, hypnotics, and anticonvulsants, but they have physical and psychological addiction potential, as well as an overdose potential, among other possible adverse effects. So your barbiturates include your phenobarbital and your nembutal. So what's your nursing consideration for clients that are abusing either of these drugs? You always want to maintain an airway because of that respiratory depression that comes with your barbiturates. So we might need to intubate, we might need to suction our patients. You always want to check and assess their level of consciousness and vital signs, because usually you see a decreased blood pressure and pulse, and even decreased mental alertness with substance or barbiturates abuse. We would always want to start our IV with a large gauge needle. We might need to give sodium bicarbonate. This would help to promote excretion. We might also want to give activated charcoal. We could use gastric lavage or hemodialysis. With narcotics, remember narcotics are normally used to treat moderate to severe pain. They are like opiates, such as your morphine and codeine, but they are not made from opium. They bind to opioid receptors in the central nervous system, although narcotics are now called opioids. So we have our morphine, we have our heroin, your horse, your junk or smack, those are the street names. We also have codeine. There's also dilaudid, which is your dihydromorphinone. And again, there's also methadone. Methadone is actually used for detoxification and maintenance. It's a synthetic opioid agonist that's used for opioid maintenance therapy in opioid dependence. So that's your methadone. Part of our nursing consideration for clients that are abusing narcotics, we want to maintain airway. Again, because of that marked respiratory depression, you want to keep your intubation equipment and your suction equipment nearby. We also want to control seizures. We could have seizures in this client, so we want to be able to control seizures, check or assess their level of consciousness and vital signs. Start an IV, we might need to give a bolus of glucose. Have your lidocaine and defibrillator available because of that possible ventricular dysrhythmia that you could see in this client. We might also need to treat for hyperthermia because of the hyperparexia. And again, we'll need to give naloxone to reverse that respiratory depression. Remember, in overdose of narcotics, what do you see? You're going to see severe respiratory depression, pinpoint pupils, there could be coma, and again, we might need to carry out hemodialysis. With our stimulants like your uppers, pep pills, speed, crystal meth, so these are some street names. They include your crack, for your cocaine, amphetamine, benzedrine, and also dizegdrine. Part of our nursing consideration is to maintain an airway, intubate and suction if necessary, start an IV line, use cardiac monitoring because of that tachycardia, increased blood pressure, the tachypnea, the anxiety. So you want to monitor your clients, check level of consciousness and vital signs, give activated charcoal or gastric lavage. And again, you want to monitor for suicidal ideation. So you want to nurse this client in a calm and quiet environment. What's our plan for these clients? You want to observe for signs and symptoms of intoxication or drug use. You want to examine the skin for cuts, for needle marks, for abscesses or bruises. You want to recognize symptoms of individual drug overdose, like hypotension, decreased respirations with narcotics and sedatives. So with a narcotic and sedative abuse, you're going to see low blood pressure and decreased respirations. Whereas with our amphetamines and hallucinogenics, you're going to see agitation. So again, want to treat symptoms of overdose, maintain respiration, especially the airway when needed. We'll need to administer naloxone, which is an antagonist to narcotics. It induces withdrawal, also stimulates respirations. Again, you want to know that this naloxone is short-acting, so symptoms of respiratory depression may return and additional doses may be necessary. We can carry out gastric lavage for overdose of sedatives that are taken orally. Remember, your gastric lavage, which will be this, involves placing a tube through the mouth or through the nose into the stomach. So if it's through the mouth, it's orogastric. If it's through the nose, it's nasogastric tube. So the toxicants are removed by flushing saline solution into the stomach, followed by suction of gastric contents. So again, you want to put your client in the left lateral decubitus position, so you can see where the tube is actually in the toxicant or the gastric content. If you put the client this way in the right lateral decubitus position, it's actually going to work in the opposite, give you the opposite effect and cause pyloric emptying. So you want to use your left lateral decubitus position. Finally, we might need to carry out dialysis to eliminate the barbiturates from the system. We would also need to observe for signs of withdrawal in these clients. For example, you see the client will be sweating, there's agitation, there's panic and hallucination. So you want to identify the drug type that was used, institute seizure precautions, keep your airway adjuncts on hand, and also want to detoxify gradually. Okay, so we can use methadone or naltrexone for long-term maintenance and acute withdrawal, especially for your narcotics. Remember, methadone is that synthetic opioid primarily used in the detoxification and maintenance of patients who are dependent on opiates, particularly heroin. And the treatment of patients, we also use methadone for treatment of patients in chronic or severe pain. Again, we want to give decreasing doses of drug substitutes and want to treat panic from acute withdrawal or marked depression. So we might need to hospitalize temporarily for psychotic response. If you see psychotic response in your client, we might need to hospitalize temporarily. Decrease stimuli, provide calm environments, protect clients from self-destructive behavior, stay with the client to reduce anxiety, panic, and confusion, and assure the client that hallucination from the drugs will subside. Again, we want to administer medication as indicated to manage symptoms of withdrawal and panic. We also want to monitor the client's vital signs. We want to promote physical health. So you want to identify physical health needs like rest, nutrition, what's the client's, does he have shelter? So you want to identify all of those health needs, especially for people who abuse substances. We also want to complete a physical workup. For example, heroin addicts needs to be followed up for liver and cardiac complications, sexual transmitted diseases and AIDS. and also you want to carry out dental care. And again, want to administer methadone for maintenance when it's indicated. We said it's a synthetic narcotic and it blocks the euphoric effects of narcotics. It eliminates craving and withdrawal symptoms. And again, we'll need to carry out daily urine collection to monitor for other drug abuse while the client is on methadone. We'll need to implement measures for antisocial personality disorders and manipulative behavior. So you want to provide a structured, non-permissive environment. You also want to carry out milieu therapy. Here you use peer pressure to ensure conformance. So milieu therapy is a form of psychotherapy that involves the use of therapeutic communities. So you can have patients that will join a group of around 30. And if this psychotherapy could last from between 9 to 18 months. Again, you also want to set limits with these clients, but you want to remain non-judgmental. And we can refer them to drug-free programs like your Synanon, Phoenix House, Odyssey House. So this would help to confront and also to support the client to remain drug-free. So you also want to treat underlying emotional problems. So we can engage the client in individual therapy where we give support and acceptance, or group therapy where they can learn new ways of interacting, or we can promote use of self-help groups. We can also assist the client with rehabilitation, getting a job, work programs, vocational counseling, family counseling, and even completion of school. And we're going to end with a quiz. The nurse notes that a post-op client has not been obtaining relief from pain with the prescribed opioid analgesics when a particular licensed co-worker is assigned to this client. Which action is most appropriate for the nurse to implement initially? You can pause the question, you can pause the video to go through the options, but the correct answer would be option 3. Okay, so you want to use your decision tree. Reassign tells me implementation, notify tells me implementation, review tells me assessment, and confront tells me implementation. Remember, assessment is the first step of the decision tree, and number 3 is the correct answer.